Hey, I'm Luke Eckley with Apollo Insurance Group. I'm here with another week of Apollo Answers. So let's dig into it with this week's most popular questions. Look at that catch. What is the biggest misconception about health shares? That everybody thinks that it's not insurance. Your ID card, it'll say this is not insurance. That doesn't necessarily mean that it's not going to act or operate or feel like insurance used to act and operate before 2010, March of 2010 to be specific, when Obamacare was passed. That completely changed the entire landscape of health insurance as we know it today. Essentially, they just said for any and all pre-existing conditions and your minimum essential coverage or your annual wellness exam, that is required by law to be covered by any and all insurance. Health shares do that on the minimum essential coverage, but they do exclude pre-existing conditions. What does that mean? That just simply means in the last 24 months, or if you've had a cancer before in the last 5 years, or a heart attack of some serious issue in the last 5 years, they will exclude coverage your first 2 years being on a plan. Now, they all have different guidelines and different things that go into that, but on a general consensus, it's a 24-month look back or 24 months of being on the plan before they're going to cover any of those types of things.
What happens if I develop a chronic condition after joining my health share? Well, what you're gonna wanna first figure out is if that chronic condition will be considered pre-existing on that health share's plan, and also figure out if you've hit your waiting period for pre-existing conditions. And if you have an agent, like an Apollo one, make sure to call them. They'll be able to handle all of that for you.
What type of person would benefit from a health share? Great question. We get this all the time. A lot of people will benefit from health shares, mainly people who are on a marketplace plan, who think they're paying too much, and then also usually healthy individuals tend to fare better with a health share plan.
Got it. How do monthly payments work and what's an unshared amount? So monthly payments for health share specifically are going to be a monthly contribution. So I'm going to pay a monthly contribution of $630 a month. Those payments go into the share and everybody's dollars are pooled together. When I have a claim, or if I see a doctor office, or if my wife, just like recently, we just had a baby and we have claims for having that baby, they take dollars from the share and they pay for any eligible medical expense. However, there's unshared amounts that are out there, such as if I had a pre-existing condition, if I had not carried health insurance for the last couple of years and I decided to get a health share, but I had seen a doctor 6 months ago because my knee felt really, really wonky, or I tweaked it and I think I maybe tore my meniscus. And I went in, got the health share. In the first 90 days, I was like, I know I need to have a surgery because the doctor said that 6 months ago, but I was uninsured. Well, that's now a pre-existing condition. The way that they have their guidelines written is it's supposed to keep everybody's contributions low. They don't want to cover any and all pre-existing conditions because they don't know if you tweaked your knee in the first 90 days or if they tweaked it 6 months ago, like I said in my example. So that's a perfect example of how contributions work, and for any eligible medical expense, how that is covered for everybody that's involved. But if it's an unshared amount, it's typically around pre-existing conditions.
Next one. How do health shares handle maternity care and childbirth expenses? This will depend on the health share that you have. A lot of health shares, though, have specific benefit amounts for different types of childbirth expenses and childcare. Make sure to contact your agent if you have one to figure out those specific numbers.
Do health share plans follow the same rules as insurance companies? I always answer this question as yes and no. Health shares can look, act, and feel a lot like traditional health insurance, but because of some of the guidelines that were put in place with the ACA, they do not allow it to actually be called insurance. And then certain things like copays, deductibles, and maximum out-of-pockets have different names or are referred to as different things on a health share plan.
Thank you for tuning in this week for Apollo Answers and the questions that we were having. Please leave a comment if you found this information was super helpful, useful to you, or just informative about the difference between health insurance and health shares and the similarities between the two. If you want to have more info, or if you have a specific question that you would like to get answered, please reach out, let us know, send us a DM or a comment. We'd love to hear it, and you may see it on the next episode of Apollo Answers.